Hi, this is Dr. Laurence at KidsAbility. I'm the Clinical Psychologist at KidsAbility. I've talked before about assessments and what that looks like, and now I'd like to talk about why it actually is important to do an assessment. So we talked about understanding what lies underneath the symptoms that we see, and that each brain is different, and so each child is different and the way you treat them is different. The most important part is sometimes it seems so evident as to what's going on. So you have a child in the classroom, they're bugging their friends, they're not paying attention, and it looks like ADHD, and it seems pretty clear, right? So let's treat a kid like that, and that is sometimes what happens when assessments don't get done. However, what looks like ADHD can be coming from something totally different. Kids with autism, they can look like they have ADHD, but they're really just in their own world, and so they're not paying attention because they're in their own world, not because they can't pay attention. Kids that are gifted, there's a lot of symptomology that's similar to ADHD for kids that are gifted because they work through the material so much faster than anyone else in the classroom, and so they get bored. And so then they start bugging their friends, or they're not getting stimulated enough. But the second that you give them really stimulating material, they can pay attention and hyper-focus for very long periods of time. So what an assessment does, specifically say for ADHD, you actually do the testing that can disseminate between the kids that are gifted and the kids that actually have ADHD. And sometimes they overlap, and that's what's called comorbidity. However, an assessment is what will pull that apart, which will say, is it A, B, C, or D, or is it maybe a combination of some of those, because that's possible too. And then the way we treat that is so different. The way you treat a kid that's gifted, who's bored, is fully different to a kid with ADHD or a kid that's on the spectrum. And so that's where sometimes therapies get done without the assessment, and then there's no progress that's made, and it's because we're basically treating the wrong underlying factor. And so that is why doing an actual assessment is extremely important.